up to my favorite bunch of beauties? Welcome back to the channel. Welcome to Monday morning makeup number 36. Welcome to October, and October is breast cancer awareness month, hence the pink top. I decided to recognize October as being breast cancer awareness month. I am going to do a pink-ish eyeshadow look. So I pulled out an old favorite, which is the Give Me Glow Vivid Rose palette, and that palette looks like this. And I decided to wear the pink top. So we are going to get started, and we're going to do a little bit of talking about breast cancer as I do my makeup. I'm going to start off to say to make sure you are doing your breast self-exams and also getting your mammograms and seeing your GYN doctor so that they can do a breast exam also. I feel that that is my civic duty to tell you that. My duty as a nurse to tell you that. So we are going to zoom in and we will get started. Oh, before I zoom in, I wanted to share with you all let's zoom this way and see if I can turn. I just wanted to show you all my Halloween decorations. So here, I changed my Scentsy warmer up. I did have the Enchanted Pumpkin. I think it's the Enchanted Pumpkin. But I changed it to a new Scentsy warmer, which is called Bite of an Apple. And it is a Disney warmer. It is from the movie Snow White. So you can't see. Let me see if I can zoom in a little bit more. You can't see it too close, but if you can, inside of the little eye sockets on the pumpkin, you can see that witch that gave Snow White, did I say Snow White? I think. But you can see that witch that gave Snow White the poison apple. But now that I have shown you all my decorations, let's zoom out so you can see it a little more. And we'll even zoom over to the door here. And let's see if I can zoom out a little more. You can see I have my boo on the door. If I zoom in a little more, maybe it'll, let's tip it up. There it is. There's my boo. Okay. So we're going to zoom in, and we'll get started. All right, so we are zoomed in. I have moisturized my face, and I use the Tatcha, the water cream to do that. And I'm going to put my primer on. I usually keep this in my little fridge here, but I'm going to do my primer, and that is going to be also from Tatcha. And this is the liquid, the silk canvas. And let's grab a primer brush, and we shall get started. My forehead is out of frame, but that's okay. So yes, we are going to have like a little bit of a big sister talk. And this is big sister as in my sister's over 40. Or 40 and over who need to do those breast exam, those mammograms every year. Also, my younger sisters who need to be doing those self-checks every month. Yeah, we're going to have a big sister talk, and we are going to dive into this topic. And this topic is something that is really close to my heart. I have been supporting like breast cancer research, doing the breast cancer walks for many years. It is all a part of recognizing women's health, because women's health has not been a priority with this country. So we're going to make it a priority for ourselves to make sure that we do what it is that we need to do to stay healthy. So we know October is spooky season. We know October is football. We know it's pumpkin spice lattes and all those things. But more importantly, it is also Breast Cancer Awareness Month. I am going to, I did what I always do and I forgot my primer. So I'm going to use actually, let me grab this brush here. I am going to just use my concealer on my eyes today because I am too lazy to get up and go get it. And it's like right there, I can see it, but I'm too lazy to get up. And this is just a Sephora Best Skin Ever multi-use concealer. So it's going to be multi-used as a eyeshadow primer today. We'll just prime this and let this have a chance to settle down and dry down a bit. And I'm going to do my brows. And of course you all know that it's the Benefit Goof Proof because that is the eye product that I'm using until it is gone. Okay. So let's kind of do something with these unruly brows. And we are going to talk about first what breast cancer is. And it is a condition where cells in the breast start growing uncontrollably and they form a tumor. This can happen to you at any age. It can happen to any gender, but it is normally or more often found in women. But because this is something that can happen to anybody at any age, that is why it is important to do early detection. And early detection through your annual visits with your GYN and your monthly self-checks, as well as getting your annual mammograms if you are 40 and over. Now, I know a lot of times you'll have issues with like insurance not wanting to pay for mammograms every year. And that's what I'm talking about when I say that this country does not, that looks a little thick. This country does not put a priority on women's health. So much can change with you in a year or less. Why do you have to wait for 2-3 years to have a mammogram done? They're going to make me go outside and protest. But yeah, try if you can to get those annual, does that brow look crazy? Annual breast exams. Annual mammograms if you are of the age. If you have to make a stink about it, make a stink about it because it is your health. It is extremely important. You don't want to catch breast cancer in stage 3 and 4 when it's almost too late. So yeah, make your health a priority even if nobody else does, i.e. your government and your health insurance. But the next thing that I want to get into is just how important those self-exams are. So I don't want you to underestimate how powerful it is for you to do your own self-exams. You know your breast better than anybody else, so you know when something feels different with your breast, and it is usually going to be you and sometimes even your partner, because they know your breast also, who will feel something that feels a little bit different. And then you can have that conversation with your primary doctor, and normally you'll catch it at an early stage because you're doing your breast every month, so you know if something changed from month to month. And the sooner you catch it, the earlier it is to have treatment and go into remission if you have breast cancer. Along with that is, like I said, your screenings and your mammograms. So for those of us under 40, It is your annual exams with your primary care provider or your GYN doctor. For those of us 40 and over, especially if you have high risk factors. Sometimes if you have high risk factors, they'll have you do a mammogram earlier than 40. Like if you have like a close family history, like your mother or your sister, your father, somebody really close to you has a history of breast cancer, they may want to do the exams a little bit earlier. But if you are someone who knows that you have like a close family history, also talk to your doctor and let them know that you do want to have that breast exam, because that puts you at a high risk of breast cancer. We're going to dig into this palette, and I am trying to think, how am I going to do this? Because we have to have these pinks in there. So I think what I am going to start with is Spill the Tea Rose right here. That might be a little bit. Let's just do He Loves Me as a transition shade. And let's grab my brushes here. And then the next thing I want to just mention is support groups. If you are someone who has breast cancer, I will say even if it is someone that you love who has breast cancer, support groups are very important. You need to be able to get those feelings out, especially if you are a caregiver. It can become very overwhelming to care for someone who has the later stages of breast cancer, and then they start to deteriorate, and that affects your mental health. So you need a support group for that. If you are actually the person who is going through breast cancer, you really need that support from other breast cancer survivors or those who are actually going through treatments or whatever they are going through, because those are the best people to tell you kind of what to expect. Even though everybody's journey is not the same, they can give you a general idea. They can also be the ones who will be the sympathetic ear because they know what you're going through. So it's always important to seek out a support system, or just locate a support group in your area to help you deal with what you or your loved one is going through. Now, I don't have a family history of breast cancer, but I, as a woman, it's just something that has always been very important to me because I have breasts. And I'm going to make sure I do everything on my side to keep these things as healthy as I can for as long as I can. Let's see. What are we going to do next? I think I'm going to start. I'm actually going to go with Flower Power, which is this shade here. And I'm going to start on the outer. Trying to see which brush do I want to use. I am going to be not using any of my white natural hair brushes because I have stained a brush with these pink eyeshadows. So for this one I am using the Sephora Pro Shadow 10 brush, and I like this one because it's kind of flat. And then we will go just sort of this way. And I think this, let me look and see. This may be a palette that has pressed pigments in it. I believe it is, and some of them do stain, just FYI. But this may be one of the ones that stain. Very pretty color though. So yes, ladies, make your breast health a priority. Also remind your loved ones it's Breast Cancer Awareness Month. Have you done your mammogram? Have you had your breast exam done this year? Just be that person. Just annoy the hell out of them until they actually get it done. I wouldn't care if you were mad at me for the rest of your life. At least you'll have a life to be mad at me. But we need to make our health a priority. We take care of everybody else. I think I'm gonna have to wash these brushes today. But I am gonna take the shade Pretty Peony, I think. No, I'm gonna take the shade Guns N' Roses. That is a shimmery shade. I just want just a regular. We'll take the Sonia G Builder Pro, and this is the shade Guns N' Roses. We're going to get some pink in there. We're going to get some pink in there. I feel like I'm concentrating on the purple, but we will get some pink in there. This is another one of those. I don't know why I haven't been using this. It's such a nice palette. And this shade, Guns N' Roses, is such a nice, pigmented, smooth, pretty shade. And we're going to go back on that outer corner, but let me finish this part first. I am going to go into the shade Pink Rosé, and that is this shade right here, and that's going to go on the inner third. I'm going to use the same brush. I'm just going to flip it over on the other side. Yeah, all of these. The Give Me Glow formula is pretty amazing to me. I really like their eyeshadow formulas. Don't always like these huge pans, which I think a lot of companies now are doing smaller pans of the same palettes, which is cool. Okay, so I am going to grab like a liner brush. Let me do this. I'm going to take one of my Kaleidos liners. I think I'm going to take this one. And this one is called Solaris. I think this is, I think this one is kind of green. So we won't do that one. Let's see. Let's see. We'll do this one. This one is God, why do they do this to me? It's too small. Anyway, I'm going to be using this one. I'll put the name on the screen because it is so tiny I cannot see it. And this one is a pink, but it kind of shifts to like a green. But we're going to put that here. Alright, and I'm going to go back to my lid again, And I want to take that He Loves Me and kind of use it to blend up here. Okay, just a bit this way. All right, okay, I think I like that. And now that I have my liner here, I'm gonna come away from the eyes for a second, and I'm gonna do the rest of my makeup. I'm gonna be using the Makeup Forever HD Skin Foundation. And let's use this foundation. Oof. These brushes scare me. They are kind of hard to clean. This one is not as dense. This is the Fenty Beauty foundation brush. So we'll use this one. I am going to spray this one with my Fix Plus. And then we'll pump a couple of pumps on the back of my hand here. And pray that we don't get foundation on my top. I want to do a little bit more around here. And on my chin, because it's a little bit darker there. All right, and we're going to do our concealer. And let me just put that back here. I am actually going to take both of these. I'm using the Sephora Best Skin Ever. I'm going to take 35 in and put it in this inner corner. And then I'm going to take 50 in and put it here. We are also going to take 50 in and dot it right there above the lip. Okay, and I am going to be using this brush here, which is the mini base brush. And I think, let me spray that one time too. And we'll do above the lip first. And then I'll go up under my eye. All right, and I have a liquid blush from Rare Beauty, so I'm going to go ahead and put that on first, and we'll use this just to blend it in. But this is the shade Grace, and because it was pink, I decided it was what I wanted to use. So we'll just put a couple of dots and we'll see. I probably should have just like done my fingers. Let's do that way first, and then we'll blend it. We need a little bit more over on this side. All right, and that is done. I'm just going to wipe my fingers off. I am going to use one of these Hourglass powders as a bronzer. Should have done that first, but we shall move on. And I'm just going to use this classic base as a bronzer brush. I'm actually going to go into the shade in the middle, which that one is Transcendent Light. And then we'll just we can even blend it up into the powder a little bit, into the blush. I mean, all right, so that is done. I am actually going to take this Milk Cosmetics. It's supposed to be a blush, I think. Yeah, it's the little Queen Bee palette, and one shade is Queen and one shade is Bee, but they both look like this. Too light for blushes for me. I think I'm going to take this one over here and use that as my highlight, and I'm just going to take this blush brush. Actually, let's do this little dual-ended brush from Tarte. And I like the way that looks over top of this blush. Okay, now that I have done my face, I am going to go ahead and finish the eyes. I am going to go up under my lower lash line. We're going to start out from dark and go to the light. So I'm going to do He Loves Me Not. I'm going to go back to Flower Power, and then I'm going to end up with this pretty peony shade. So we'll go from dark to light. and then Flower Power in the middle here. Let's do a little bit of this, more of this one right here. And then we are going to, same brush, go into Pretty Peony and put that here. All right, and I think let's try this. I am going to, I wonder what, do I have any other thing with a pink in it? Let me see. I want an inner corner highlight. I'm just checking my other palettes for the week to see if there's a color that I want. Okay, so I'm just going to go into the Sunrise palette from Natasha Denona, and I'm going to grab this shade Awakening, and that'll be my inner corner highlight. Yeah, nice and pink. Alright, and I am going to do my mascara off camera, and I'll be right back. Alright, so mascara is done. Eyes are done for the most part. Actually, let's take one more shade, spill the tea rose, and just put it on the brow bone. I will take this brush here, just to top it off with some pink. And kind of blend it a little more. Alright, I don't even know if you can see that, but I used it. Alright, and to finish this off, I am going to do my lips. And I'm going to line my lips first with the lip liner from Juvia's Place in Scorpio. And actually, won't be completely lined. I think I'll just do these corners so it can be sort of more of an ombre look. Okay, so we'll start like that. And I'm going to use my favorite pinkish lipstick ever, and that is from MAC, and it is Flat Out Fabulous. This is the new one that I just picked up to replace the old one. And I had a little synthetic brush I want to use to kind of blend this a little bit more. Okay, let's clean that up a bit. wash that off too. All right, you all. Let me spray my face. And I am going to zoom out and I'll be right back. All right, so this is my pinkish look for breast cancer awareness and our big sister conversation to remember to do your self-exams, to see your GYN annually and have them do a breast exam also. And if you are 40 or over or high risk and under 40, please have your mammograms done. Thank you all so much for watching this video. If you enjoyed it, please give it a thumbs up and subscribe to my channel. If you are already subscribed, please make sure you hit that notification bell so you know when I have a new video coming out. Have a great day, and don't let your day be a waste of makeup.